of the big goal is just to get him bigger, older, and stronger. And so if we can keep him healthy for the next, 10 years or so, at that point, we think we'll have a really good handle and he'll be able to lead a normal life.
Lucas is an amazing kid. He's had so many health challenges, so that's kind of made him more determined to do whatever he tries to succeed.
I got a call at home from Lisa, and she said, "You need to come out here. The doctors found something." And we went out there, and then they had heard a murmur, and so they did a echocardiogram.
We were told that he had a really large hole in his lower chamber of the heart and small holes in the upper chambers of the heart. We just thought it was just a heart condition. Then we noticed that he wasn't able to speak. He also had immune system issues where he went into septic shock, and we thought we were going to lose him. His organs were failing.
We were referred to the University of Iowa Immunology Clinic. We were also referred to an ENT specialist here.
They did a test called a FISH test, and that came back positive.
Lucas had DiGeorge syndrome, or 22q11.2 deletion syndrome.
With that, there's a section of the 22nd chromosome that is missing, and because of that, it can cause numerous health conditions, pretty much affecting all systems, whether it's heart, immune system, orthopedic, palate, feeding difficulties, learning, developmental disorders as well. He also has scoliosis, so he wears a brace. So it was the final piece of the puzzle that made sense to us. With DiGeorge syndrome, he had surgery at 3 months of age.
The pharyngeal flap surgery that helped him keep more of his air coming out of his mouth instead of through his nose. He was hypernasal, and so he could not pronounce hard consonants.
It's called velopharyngeal insufficiency, and what that means is his palate isn't long enough to close off the nasal cavity, so all of his sounds were coming out of his nose instead of out of his mouth. So he had to have a surgery to lengthen that so he can speak clearly.
After he had that surgery, he actually had a burp in the hospital room, and I said, "Lucas, what did you just do?" And he said, "I burped." Clear as day, the B and the P. I mean, our eyes watered up. Dealing with DiGeorge syndrome and the things that come with it, he's had more challenges than the average kid when it comes to learning, just because he couldn't quite speak correctly, and because he couldn't say the words, sometimes that leads to not being able to read and comprehend the words also. The last few years, he hasn't had any unscheduled hospital stays, which is a fun way to say it. He has had a revision surgery for his pharyngeal flap, and that was in and out in one day. He still receives great care from all of his doctors that he sees here in Iowa City.
They do a great job spending time with him. They listen to him. They explain everything that they need to have done here at the University of Iowa. It's so important to have pediatric specialists in the same state. With DiGeorge syndrome, you have numerous conditions that need different pediatric specialists.
If you talk to him, he's going to say, "No, I wasn't afraid."
I remember surgery at Iowa City. I was very brave.
He knows that, okay, when it's going on, he's not going to feel it. And when he wakes up, he knows he'll be a little sore, but for the most part, he's surprisingly in a good mood. And then the staff, for the recovery period, they keep him focused. They ask him how he's feeling. Is there anything that he would like to do? And of course, he's going to list off 100 things that he would like to do. Maybe one or two of those he can actually do in the hospital room, right? I can't say enough about what the staff here at the University of Iowa has done. Lucas's attitude has been way better than mine or anyone else that I could imagine.
I hope that he continues to have that strive to overcome any obstacles. He's a fantastic drummer, like I said, so he always says that he wants to be a drummer, a musician. I just hope that everything's positive for him, that he continues to stay healthy. It's been 3 years since he's been hospitalized for a major illness. So I hope that he continues to stay healthy, continues to not have any more conditions if that the DiGeorge syndrome is affecting.
I want him to be able to do whatever he wants to do with his life. And based on what I've seen so far, he'll be able to do that because of the help that he received here at the University of Iowa and because of all the support that he's had throughout his life.